In Colorado, for community-based domestic violence advocates, there are only 2 exceptions to confidentiality, and that's known or suspected child abuse or neglect, and a release of information that is done properly, meaning that it's time limited, it's voluntary, it's written, and it's informed. And so that mandatory reporting does not include elder or older folks in our communities. In other statutes, folks who are 70 years or older are identified as potentially being at-risk adults, but that mandatory statute for reporting does not apply to community-based advocates.
So if individual agencies have policies that say they are mandated reporters of elder abuse, then they're actually not aligned with Colorado law, correct?
Yeah. And it gets a little more complicated for programs that have in-house mental health providers in them. So say, for example, a program has a mental health professional as part of their staff who provides mental health services to clients. They may have different mandatory reporting requirements that they have to follow due to their licensure and those standards, which they can do, but they have to notify the survivor that they're working with beforehand. And there are some best practices around programs that have both mental health and advocacy services. And so we have a lot more information about that in our confidentiality toolkit. And so that's a good place to go. But it does get trickier for programs that have both types of services.
One of the things I wanted to point out is that actually when the at-risk adult statute passed in Colorado in 2016, it was intentional for community-based advocates to not be included in that. And so it's important to recognize that it's not in the statute for community-based advocates to report in order for adults of any age to have confidential access to advocates. And then as far as advocates working with older adults, I think that it's important to remember that, just because someone's older, it doesn't mean that they don't have a right to make their own decisions and ask for help and support about whatever they are wanting and needing in their life and their circumstances. But there's also some things maybe to take into consideration for advocates to take into consideration when working with older adults that might be barriers. And I think that some of those barriers can be sometimes mobility issues or sometimes access to transportation, or also sometimes not being able to come in for regular appointments because maybe they work with, or maybe they're at home with an abusive partner during the day and they can't come in for regular appointments. I think one of the other barriers that's common that sometimes we don't address very much is that sometimes older adults don't necessarily feel comfortable sharing personal information with a younger advocate, for example. And, I think that ultimately what that means is having a chance to really take more time to build rapport, but also in a really gentle and direct way, being able to name that age gap and talk about how best to work together. So some of those things can be barriers, but they can also be ways to really understand an older adult survivor and their needs. And really, it's important for advocates to be aware of all of those pieces. Yeah, I think that maybe one more thing to think about is that maybe some of the forms of abuse, all of the forms of abuse are going to be potentially the same. So all of the DV basics are going to be there. So safety planning, community resources, talking about the impacts of domestic violence and psychoeducation about domestic violence, all of that stuff's going to be there. But sometimes there might be extra layers, like maybe understanding that, maybe exploring if someone is being harmed when they're being physically cared for or physically helped, or if maybe someone's withholding medication or withholding basic needs, that those are also forms of abuse that we see a little more often with working with older survivors.
Mm-hmm. And I think it's important to think about, and this is a skill that advocates already have, but it's important to think about how we're safety planning for folks who have to continue to live with or interact with their abusers. For older adults, it may not be possible for them, or it may not be the choice that they want to make, to leave an abusive relationship. Or if somebody who's being abusive is a caregiver, they may have really limited options around that. And so thinking about those safety planning skills we already have, and those things we already do with survivors to safety plan and talk about harm reduction for them while they're in those situations.